having a little bit extra training like an EMT or an MA can really help get your foot in the door and have a position that is going to be much more significant than just, maybe doing a volunteer at a hospital where you're delivering water to patients. You're going to actually be involved in patient care.
Hi everyone, third year medical student here. As someone who applied to med school successfully as a first generation student, I wanted to hop on here and share with you some tips for finding extracurriculars that are going to give you the experiences that this Dean of Admissions is talking about. Obviously, people are going to have various challenges that they need to overcome in life, and so I think most people will already have one or two stories in their back pocket that they can tell when asked about what they did to overcome a challenge or solve a problem or something like that. However, I think it's really, really important as a pre-med that you are very strategic with the way that you are choosing your extracurricular activities, because some extracurriculars are going to give you more opportunities to have stories like this than others. So I think to start, the first number one most important thing is going to be clinical experience, and this can come in the form of volunteering at a hospital, shadowing a physician, or just getting involved with some type of clinical research where you're actually involved on more of the patient care side. A lot of students also get jobs working in healthcare, which I personally wish I had done and think is such a valuable experience just for you figuring out if this is really what you want to do, because there are a lot of surprises that you experience in the healthcare field if you have not been introduced to it before. So I think understanding that and knowing what you're getting yourself into is super important just on a personal level, because you don't want to be finding these things out for the first time when you're already in medical school.